another exciting episode of your program of choice, Health Affair on AIT. I am your regular anchor, Oshuomowa Daniels. On the program, we'll focus on public health issues and the challenges of women and children with a view to finding lasting solutions. In commemoration of the 2021 International Cancer Awareness Month, we focus on awareness campaigns and the impact of cancer on the family and society at large. In our last week's episode, we also invited some stakeholders to speak to us about their experiences. On this week's episode, we shall be continuing with the cancer series, and this time around with a special focus on breast cancer.
Hello! Did you take part in the 2021 Arise Walk for Life? Please plan to attend the Arise Conference coming up on Saturday, 30th October 2021 at the Church Auditorium, the Redeemed Christian Church of God, City of David Parish, Victoria Island, Lagos, Nigeria. Not only will you meet with great speakers and women of worth to revive your destiny, but you also have an opportunity to receive the COVID-19 vaccination as Dr. Siju Iluyomade gets the North Arise Conference approval as a vaccination center. Come on, get on the Arise buses and get your COVID vaccine. God bless you. To help women survive the prevailing harsh economic realities and reduce unemployment rate, the Officers' Wives Association of the Nigerian Armed Forces Resettlement Center, Oshodi, has trained several women in fashion designing, leather works, baking, and other various crafts to make them self-reliant. The event, which took place on the 22nd of October 2021, saw all the beneficiaries presented with starter packs.
It gives me great pleasure to be here this morning as the guest of honor of this special occasion, celebrating the graduation of participants of NAFICOA Skills Acquisition and Empowerment Program. I'm particularly delighted to be back again to this Center of Excellence, having been the immediate past coordinator of NAFICOA. It is indeed heartwarming to know that the association is still recording unprecedented success in line with its motto, which is service to mankind. We are all aware of the economic impact of the COVID-19 pandemic on most countries, and Nigeria is no exception. The prices of basic goods and household commodities continue to rise while incomes have remained fixed. This reality justifies the need for alternate legitimate source of income, which training and empowerment programs such as this aim to achieve. I therefore urge the graduating participants to immediately put all the knowledge and skill acquired to good use in your immediate vicinity, the barracks and wider community. Remember that no knowledge is a waste, and success belongs to those who are determined to excel against all odds. I also urge you all to be very innovative, as it is an important trait to keep you ahead in a very competitive market. I encourage you to take full advantage of social media platforms for publicity of your goods and services. In addition to providing alternative sources of income, this program also helps to reduce unemployment among women and youth in the barracks. I further encourage you to continue to pursue knowledge and educate yourselves from open source of information, such as the internet, books, magazines. This will help you develop good business skills to make and manage profits while expanding your businesses.
That went to the barracks and look for the ones that truly needs this empowerment, because there are some that have done before that are not using the skill they learned. So we took our time to select those that really needs it. That's for the less privileged, the ones that we do well with the skills acquired. We'll go around and look at their work. Maybe after either we are thinking of 3 months or 6 months, but there's a follow-up committee on ground. Cannot be It cannot be a one-time event. We are looking forward to doing a bigger one by God's grace.
Going, yes, sir! We present to you the 10th Rotarian President of the Rotary Club of Lekki Golden, Rotarian Ayotunde Olayinka. He is the President after all.
Do solemnly pledge that I will faithfully execute the office of President of the Rotary Club of Lekki Golden, and I will uphold the Constitution and bylaws of this club.
We also believe you will uphold the high traditions of your club, that you will give the best of your executive ability in furtherance of the interests of your club and carrying forward of the object of Rotary.
That signaled the official commencement of work for the Changemaker President, Rotary Club of Lekki Golden, Ayotunde Olayinka, and his board of directors for the 2021 to 2022 service year. To achieve the collective goal of service to change lives, they challenged everyone present to give their talents and resources to impact humanity, especially in the area of maternal and mental health care.
There are many areas that Rotary impacts life, but the maternal and child health program is very close to the heart of Rotary Club of Lekki Golden. It's one of the clubs that has a very substantial proportion of its membership as women. Women of means, women who also have gone through the life path experiences. And then you look across the road, you find out that there are so many other women who don't have this privilege of a decent life path experience. I think the birth experience itself is challenging enough, it's phenomenal enough that a woman should not go through it at increased risk of life. And what Lekki Golden has resorted to do is to run a pilot project of 100 women in the first place and scale it up gradually, whereby we can participate in the entire gamut of activities from conception to delivery and post-delivery, to make sure that these women don't just experience life paths, but also post-life immunization. And the children are not born into poverty.
The continuity of any nation or any race is contingent on maternal and infant health. So we believe that as a club, we decided that strategically we need to, it's not just a one-year strategy program for us. It's going to span over 3 years. We're going to engage primary health centers in our constituency, being Ibeju-Lekki, Etiosa local government. So we're going to adopt, in this year, we're going to adopt about 5 primary health centers, whereby as women that cannot afford quality, health care for their children, to have, to give birth and all that, so that to make that process as seamless as possible and memorable also. So the value chain here is when they're doing prenatal, then to make sure that, this issue of CS, cesarean section, it causes a lot of stigmatization amongst women. We're going to do some advocacy around that if you need to do CS, there's nothing stops you from being a woman, to continue to be a woman because you did a CS. But if you need to do a CS, money should not be a stumbling block, because your health is important as a woman. So it's something that we are passionate about, and we will continue. Even after that, women in Nigeria suffer postpartum depression after pregnancy and after delivering the baby, especially first-timers. The life they adjust to as a new mother can be overwhelming. Especially some people that don't have mothers or support system to support them through that, that period. So we also want to take that on, getting psychiatrists also to help the women, talk to them, somebody to talk to, and to advise them adequately on what they are feeling.
So we have about a couple of things lined up for the year. We pray that we are promoting peace as well. So it's one of our Rotary objectives. So We are going to do a lot of things this year and pray that God will give us the ability to complete all our projects. I mean, you look at all the difficulties we have in the attendance today, shows that the club is actually developing, and then the new president is a very amiable person that is leading the club, to stabilize the club, and then be able to execute another project for this current year. So we are very happy today that we are able to fix a date and get us to pass.
What I see and experience here this evening reinforces my passion for selflessness and more than ever my belief in the position of men, which I've just quoted. I have no out of doubt that this gathering of committed Nigerians with shared philosophy of making the world a better place for all can move mountains and be the change agent for many things beyond our imagination. And I want to congratulate the new team. I want to wish you the best, and I believe as you contribute your quota, we will experience those little drops becoming great oceans.
In commemoration of the 2021 World Polio Day, the Changemaker president reiterated the commitment of the club to kick polio out of the world.
I think one of Rotary's biggest successes is eliminating polio. But is polio absolutely eliminated? No. Maybe in Nigeria, yes. But there are two countries where polio is still present, and the wild polio virus does not need visa to cross countries. It means that somebody can go to that country and bring it back to Nigeria or take it to another country. So the goal is not achieved until polio is out. So today what we're focusing on is kicking polio out. The very last kick of the match. We're in the 90th minute of this game. Maybe in the 89th minute, maybe we're in the extra time. But we must not concede. We must not concede to polio. So the polio, the last kick, the money we're collecting today may not be spent in Nigeria, but may be spent in countries, will be spent mainly in countries where polio is still rampant, for the children of the world, for the children everywhere.
Though the Rotary Club of Lekki Goldie is just 3 years, it has won an Eagle Award, which is a professional excellence award that seeks to recognize the high-profile professionals currently involved in the services to humanity. With the focus on maternal and mental health care for the year 2021 to 2022, their impact on human lives, no doubt, will be far-reaching.
In the name of God the Father, Amen. God the Son, Amen. And God the Holy Spirit. Amen. Thank you so much. The Pharmaceutical Society of Nigeria 94th Annual National Conference. This year's conference is tagged Garden City 2021. It will open on Monday, 1st of November, and by 6th of November 2021, many of us will be leaving Port Harcourt, River State, back to our locations. The key objectives of our annual conferences as enshrined in our constitution are to appraise our activities in the closing year and then address key needs, key areas of need, and review and take stock and plan on how to move on to the succeeding years. It's also an opportunity for us to have what we call peer review that enables us to close gaps in practice within ourselves in the country, and also to get the benefit of international attendees at the conference to sharpen our own competitiveness in the areas of pharmaceutical practice. We're going to be looking at lessons learned in the area of the health of our nation and health of individuals, the economy, the structure and personnel. We have always raised that awareness that the health of citizens of every country must be priority. It must be priority, because it's only when people are healthy that they can do anything else. Anything else. Continue to ask governments of our nation, both at state and national levels, to increase allocation to health care. The current allocation is still unsatisfactory. And I've always wondered that if it went for aid from multilateral, bilateral, global fund, Nigeria and many African countries would be in deep trouble because they are the ones fighting malaria for us. They are the ones fighting tuberculosis for us. They are the ones fighting HIV/AIDS for us. And yet, we can't even take care of our secondary or tertiary or primary health centers. So it's clear that I agree, I subscribe to putting more money to health. However, I also add to increasing accountability and ensuring we get value for money. Today, people are still quarreling, should they take vaccine or not? And bringing all kinds of arguments to say that vaccines cause trouble, they cause magnetic induction and attraction. Those things are not true. We also are calling attention on increased focus on mental health. This is an area that is neglected in our country. Assessment of mental alertness, assessment of the state of mental health is seldomly done. If you go for a routine check, they're going to check you everything, check your heart, check your liver, check your kidney. Nobody checks your mental alertness or mental acuity. Nobody. Because the only time they know you have mental problem in Nigeria is when you start removing your trouser in the marketplace. Then they say there's trouble. But until that, even when you button your shirt wrongly, nobody observes. They think it's a new style. So we're calling on government to put some focus on mental health. Mental health is becoming an issue, and we're also calling on pharmacies themselves to include that in their protocols, in their pharmacies.
We are expecting about 4,000 pharmacists in Port Harcourt. So to attend to 4,000 people is a lot of work. So the CPC has worked around the clock to make sure that we have a very successful conference. The conference starts properly on Monday. So Monday morning, in the early part of the day, we're going to have a health walk. And that will be led by the President and the First Lady of River State. So shortly after that, the President and some members of the NEC will pay a visit to the governor in his office. I mean, you can't go to an Oba's palace and not go to tell the Oba that you're in town. So we need to pay that courtesy visit, which will be led by the President. That will be on Monday morning. Then in the afternoon on Monday, the deans will have forum. The deans from different faculty, university faculty around the whole country, they will have a forum where they will discuss academics and other things. Then later in the evening on that Monday, we have a welcome reception. So by Monday, we expect that majority of people that are coming for the conference will be in town. So they will come for a welcome reception at Alfred Spiff Civic Center. That's where the conference is taking place. That's for Monday. Then for Tuesday itself is the proper opening ceremony. That will happen in the morning. And it will happen at the main bowl of the Alfred Spiff Civic Center. We expect the governor to come to our opening ceremony and declare the opening ceremony open. And shortly after that, we'll go to the exhibition stands. We have over 100 pharmaceutical companies who have indicated their interest to participate in this year's conference. They'll be showing us new drugs, new molecules, new ideas.
Operatives of the National Drug Law Enforcement Agency, NDLEA, have arrested a 35-year-old woman, Mariam Dirisu, in Edo State while attempting to smuggle cannabis hidden in wraps of sticky dough, popularly known as fufu, into NDLEA cell for a suspect in custody. The Director, Media and Advocacy, NDLEA, Femi Babafemi, who disclosed this in a statement, said the agency also intercepted over 2,060 kilograms of assorted drugs comprising heroin, methamphetamine, cannabis, tramadol, and Rohypnol in operations at the Murtala Muhammed International Airport, Lagos, as well as in Ondo, Edo, Kano, Kaduna, Plateau, and some Korea companies. Over 86,000 Lagosians have been enrolled on the Lagos State Government Health Insurance Scheme to ease their access to better healthcare services across the state. These residents were brought into the scheme through the government subsidy and private sector sponsorship, a measure to ensure universal health coverage within the state. The Lagosians who were enrolled on the health insurance scheme, codenamed Ilera Eco by Lagos State Health Management Agency, were also among the 526,846 residents benefiting from the scheme made necessary for all residents in Lagos State. This was revealed by the General Manager, Lagos State Health Management Agency, Emanuela Zamba, during an interaction with newsmen in Lagos. She hinted that in the next 1 year, at least 3 million residents will be enrolled into the state health insurance scheme. The Lagos State government has responded to a report that inbound passengers at the Murtala Muhammed International Airport, Lagos, refused to remit the mandatory PCR test fee payment into a private account belonging to a member of staff of the government-appointed firm charged with the responsibility of collecting the COVID PCR test payment and connecting passengers to approved designated private COVID PCR test centers. The state government, in its response, noted that it had, through the Ministry of Health, officially begun the collection of payments of COVID-19 PCR tests on the 15th of September 2020 through the services of its contracted partners for a smooth implementation of the mandatory COVID protocols as declared by the federal government for inbound passengers. They also revealed that a detailed forensic audit for the period in question has commenced to track all payments made by passengers in country. The final report of this audit would be made available to the public, and if any unscrupulous acts are detected, it will not go unpunished. The Bill and Melinda Gates Foundation has announced its commitment of up to $120 million to accelerate access to the investigational antiviral drug Molnupiravir for lower-income countries as part of its COVID-19 response effort. The funding allocation will be based on consultation with partners and will support the range of activities required to develop and manufacture generic versions of the drug. This commitment also builds on the Foundation's ongoing efforts since the start of the pandemic to increase access to COVID-19 vaccines, tests, and treatment. The Foundation's co-chairman, Melinda Gates, also called on other donors, foundations, and the government to act accordingly. The World Health Organization and the United Nations International Children's Fund, UNICEF, has tendered its support to the resumption of house-to-house polio vaccination across Afghanistan. The vaccination campaign, which begins on November 8, will be the first in over 3 years to reach all children in Afghanistan, including more than 3.3 million children in some parts of the country who have previously remained inaccessible to vaccination campaigns. The WHO representative in Afghanistan, Dapenglo, who called the campaign an important step in the right direction, added that multiple doses of oral polio vaccine offer the best protection. He also said that a supplementary dose of vitamin A will be made available to children aged 6 to 59 months during the upcoming campaign. The WHO and UNICEF also called on authorities and community leaders at all levels to respect and uphold the neutrality of health interventions and ensure unhindered access to children now and for future campaigns.
According to reports by the World Health Organization, there are over 50 types of cancers and some are more common than others depending on various factors, which include age, gender, racial or ethnic groups. Breast cancer, which is our focus today, is more common in women. Breast cancer occurs in the cells of the breast based on research findings. In Nigeria, for instance, more than 100,000 cases are recorded annually with several deaths. Most of these deaths have been attributed to late presentation, which makes it difficult for the doctors to do much for the patients.
When you have abnormal cells in the breast, then it is called breast cancer. And the reason these abnormal cells become a problem is that most times they don't just stay in that area. They decide that that breast is not just enough, and they would migrate to other parts of the body. So you hear of metastasis or spread. They can go to the liver, they can go to the chest, the lungs, they can go to the brain, and that's actually where the problem begins. Because if the breast cancer stayed alone in the breast, then all you needed to do was, either do a surgery to remove the cells or treat it locally. But the problem that most people face when you hear, oh, advanced cancer, oh, she presented late, is actually the fact that the cancer has gone to other parts of the body. So while the doctors are trying to, plug it here, it's also over there. You're trying to plug it there, it's still there, and that's what actually gives that whole picture where people are so unwell. So, without going into too many statistics, I just want to mention that breast cancer is actually the most common cancer, not just in women, but actually globally in the world, and remains the leading cause of death. In 2020, WHO noted that breast cancer formed about 2.26 million cancer cases in the world. And interestingly, when we talk about incidence means, the frequency of something occurring. Simply put, the incidence of breast cancer is actually higher in the developed countries more than in the developing country. So, as we all know, Nigeria is a low to middle income country or a developing country. However, breast cancer is found in higher numbers in the developed countries. So the high-end countries, the US, the Canada, and yet the number of people dying are more in our developing countries than in the developed country. I mean, why do we think this is so? And in more recent years, we have found that the incidence in countries like Nigeria is beginning to catch up with the incidence in the developed countries. Again, why is this happening? And of course, we do not have the infrastructure in place to actually contain this rise in incidence. However, we have one or two tricks that we can use to stop this. So first of all, symptoms of breast cancer. I think maybe I can ask a question here. What symptoms do we know related to breast cancer? Lumps, very common. That is the most sort of popular response from people because that is what a lot of people present with. Lumps in the breast. Or the runge, that's what it's called, where the lump has grown and has invaded even the top skin of the breast. So when you look at that breast, it looks like an orange peel. And when somebody presents with the breast like that, it's actually not an early stage anymore because the lump has grown beyond you just trying to feel it, and you can actually see that the whole breast is hard. So per the runge. There are some other presentations of breast cancer that people are not are not aware of. So you have discharge from the nipple, like bloody discharge or a discoloration from the nipple. And that is why when we advise women to check their breasts, we're not just asking them to feel for lumps or feel for that peau d'orange. We're also asking them to check the nipple. You squeeze the nipple, you feel the armpit for lumps or lymph nodes there. So these are some of the common presentations of breast cancer. But people can also come to you and say, that they've noticed that one breast has suddenly become bigger than the others. So that's not to say that one breast cannot be bigger than the other. A lot of people actually have from birth one breast being slightly bigger than the other. You wouldn't notice, but you know, the person knows, and it's not abnormal. But when you get into the habit of examining your breast, you would notice when one breast suddenly, abnormally becomes bigger. The other thing is, people think that pain is a part of breast cancer. Interestingly, most breast cancer patients don't actually notice pain initially. And so if you have pain in your breast, always get the doctor to check it out, because there might actually be other causes that have nothing to do, you know, our bras, posture, different things, and menopause. Now, when breast cancer has become advanced, there are other symptoms the person might then feel. If it's gone to the liver, they begin to feel unwell. If it's gone to the lungs, they develop a cough. If it's gone to the bones, like the spine, you get back pain and all that. If you're obese, if you're not exercising, if you're not eating properly, if you're stressed, if you're sleep deprived, what it all means is that if you're smoking, if you're taking a huge amount of alcohol, all these things are affecting your immune system, making you a lot more at risk, higher risk of developing abnormal cells. Because if you remember the way the cells in the body, if we remember our biology, the cells in the body have a natural cycle. You get your cells, like a newborn baby, it grows, carries out its functions, whatever part of the body, and then it dies. That's normal. That is the normal cycle of life. And it's happening at that cellular level. With cancer, these abnormal cells, for some reason, and some of the reason are these risk factors I've mentioned, will suddenly decide to go haywire. They either start growing and growing and growing and growing. They don't stop growing, even at the point when they should stop growing and die off. So you have an accumulation of these, and as they are growing, they also become abnormal in the function they carry out as well. And in some cases, you then find the lump, because the cells have grown so much that you can actually feel the lump. As you get older, not just with breast cancer, but with a lot of other cancers, the risk of cancers increase. And the fact that some cancers are run in families, there's a genetic component to it. In fact, for breast cancer, 1/4 of the cases we see have a family history, which is why when we do our history taking, when a patient comes in to see us because they have a new diagnosis, as important as it is to also ask about her own, problem, we always ask about family history. And you find that it might be that a mother had it, or a mother's aunt, or a grandmother, or her older sister. There's a family history. And that is why increasingly we are also encouraging people, know your family history. What runs in your family? Because having that information will modify how you actually treat yourself. If I know that I have hypertension in my family or diabetes, it means that in my early 30s, my mid-30s, I am going to go to the doctor to keep an eye on my blood pressure, keep an eye on my blood sugar, try to maintain my weight in such a way that I have a healthy weight, try to eat healthy, try to exercise. So if you didn't have a motivation before, knowing that there are certain illnesses within the family will help to motivate you. And that's the same with cancer as well. There are families where there's breast cancer, prostate cancer, and it's important to know. And that brings us to the next level, early detection and screening and prevention. Prevention really means you want to put measures in place before the thing happens. That's prevention. Because after prevention is the thing has happened. So what are the things you're doing to prevent yourself from getting breast cancer or any cancer? And that is what I've just talked about. Healthy lifestyle, basically. Now, part of prevention, or next to prevention, is then what else should we do to then focus on detecting something if it actually then happens. And what we do is screening. So in our environment, the next thing that will follow that is, it is not my portion. I don't want to know. But, you know, that whole attitude has caused so much sorrow and tears in families. Let's just take a moment to think about that. 5 or 7 days after your period, make a date with your breasts. Go in front of a mirror, admire your breasts. And when I say admire your breasts, we admire our faces. And what it means is that when I have a pimple, when I have hair growing, I can see it, I recognize it. When I haven't slept well and I have bags under my eyes, I know. And that's because we are admiring our faces daily in front of a mirror. We need to get to know our breasts just the same way. Now, if you've got to the age menopause where you don't have a period anymore, then take a day every month when you've marked off on your calendar that you will check your breast.
From the detailed explanation by our experts, I'm convinced that you have learned much about breast cancer today. Please spread the information and also take the necessary actions to save more lives. Next on the program is our nutrition segment. Hello and welcome to another edition of
Apples are among the world's most popular fruits. It comes in different varieties of colors like green, red, and yellow. The green-colored apple is said to be used in maintaining bones and teeth. It is also said to aid good vision and provide anti-cancer properties. The red color is good for the heart and memory function. It also reduces cancer pains and maintains urinary tract. While the yellow apple is good for the heart, eyes, and boosting the immune system, and also reduces some risk of cancer. This crunchy, delicious, and juicy fruit is produced by an apple tree, Malus domestica. The tree originated in Central Asia, where its wild ancestor, Malus sylvestre, is still found today. Apple fruit is one of the most favorite and popular fruits ever known. This fruit, sometimes called the king of all fruit, has been grown for thousands of years in Asia and Europe, and were brought to North America by Europeans. By all aspects, the fruit is indispensable because apart from the health benefits and nutritional values, it is also known for its medicinal values. Little wonder the saying that an apple a day keeps the doctors away. The fruit, which has long been associated with the biblical story of Adam and Eve, is among the favorite lists of ancient Greek and Romans. In Norwegian tradition, a magic apple was said to keep people youthful eternally. Apple trees are cultivated worldwide. In 2018, the world production of apple fruits was 86 million tons, with China producing 46% of the total tonnage, and United States, where the fruit is mostly popular, coming second. Apples can be consumed in various ways, as juice, raw in salads, baked in pies, cooked in sauces, and spreads like apple butter. A 100-gram serving of apple fruit provides 52 calories of energy, carbohydrates, 4% of daily value, 9% daily value of dietary fiber, vitamin C, 7% of daily value, potassium, 3% of daily value. This wonder fruit is notable for its phytonutrients and antioxidants.
On our clinical segment, we give you vital health tips.
Hepatitis is an inflammation of the liver. That means it is injured, okay, and it cannot function very well. And sometimes it can lead to cirrhosis. It hardens it, and that can also progress into cancer. Hepatitis can be caused by viruses or even taking of toxic substances. Just like they encourage people to test for HIV because they say it doesn't show on the face, you have to get tested. And if one is tested, they say that prevention is better than cure. If one is tested and is positive, such an individual could be managed.
We welcome your contributions on how to improve the nation's health sector and human lives on our perception segment.
Only give it to the people in their party for everybody. The one they did in my environment, even what did they even give? By the grace of God, I saw a bread like 150 naira bread with the logo of the politician that distributed it. And some they give them, in some area they add what they call this thing, spaghetti. Is that is that palliative? Is it lunch? So there's no sincerity about it.
This is where we draw the curtain on the program today. Thanks for spending your time with us. Please, let's do it again, same time next week. My name is Oshuomowa Daniels. Keep staying safe.